So I think one thing we all know, that being a doctor is really not easy. It's actually progressively getting worse day by day. And I think there are multiple reasons for that. Lots of paperwork, you're treated as knights, you think of yourself as being knights who are out to help patients, and effectively you end up being treated as knaves. Lots of us are pawns. It's hard to really get enough credit for the hard work which we do. And this is often what the life of a medical student is. And what's worse is, it really is going to be part of it, because hospitals are high complexity zones. There is just so much opportunity for things to go wrong. And especially in a place like KEM Hospital, when you're so overburdened by work, imagine you've spent 2 sleepless nights, this is the 3rd day in the OPD, you have all these patients, lots of your patients aren't very articulate, they don't know what their problems are, and still you need to be able to sort some of this out. So it is definitely a breeding ground for error. But it doesn't end just when you graduate from medical college. Even when you end up going to practice, it's become a bit like this. This is what is called doctor shopping. It's not like a patient will come to you and say, yes, you know, you're God, you do whatever you like. Doctors will choose, do I go to patient, Doctors don't get to choose anymore. It's patients who decide, will I go to this doctor, that doctor. It's become highly competitive. And this is a big problem, because lots of patients these days will do a Google search. And because they've done a Google search, they obviously think, hey, God, we know everything. And the problem is, sometimes you need to remind them that, yes, a Google search is great. We want patients to be well informed and well educated, but that's really not the same as having a medical degree. But today, this is sometimes what the situation for the poor patient is. It's not like the patient enjoys going from one doctor to another doctor, but the patient is completely confused. And often Google is responsible for that, because they go to Dr. A who tells them something, Dr. B tells them something else, and Dr. C ends up telling them something completely different. And trust me, if you think listening to lectures in medical college is boring, once you start practice, you're going to have to listen to so many more lectures from your patient who, because they've been to other doctors or because they've run stuff on a website, they end up thinking that they know a lot more than you. But you know what? Medicine is a service profession. You can't afford to lose your temper, and you jolly well need to learn to be patient. But the big problem today is anything which goes wrong in a hospital, whether the oxygen runs out, whether the IV fluids are contaminated, for anything which is completely outside a doctor's control, the first rule is the doctor messed up, have them jailed. And the problem is doctors have become extremely soft targets. And I think this is such a problem, because this never used to happen when we were junior doctors. But today you keep on reading about these incidents about doctors being bashed up in spite of all the security measures. And doctors now feel increasingly insecure. And I think sometimes this is true. I think sometimes you don't need more hats. You actually need more heads in order to deal with this problem. So I'm not trying to complain about what's happened. I think the reality is that, yes, the present is grim. But I think the good news is there is a lot we can do in order to fix these issues. And this is where we come to the ABCs of being a good doctor. All of you are going to sit for multiple exams, and I'm sure all of you love mnemonics and acronyms. So I first started off with A to Z of being a good doctor. But I thought A to Z was too long. Dr. Sangeeta said you only have 20 minutes. So I said, fine, let me cut it down to just the ABCs of being a good doctor, where A stands for accountability, B stands for bedside manner, and C stands for continuous learning. So that's easy enough to remember, and I'm going to go through this again. What does accountability mean? And I think sometimes we forget that being a doctor is such a great privilege, because you're treated as a respected professional. And the reason you're treated as a respected professional is because you have a fiduciary responsibility to your patient, that it is your patients who come first, irrespective of where your salary comes from. Please learn to take full responsibility for your patients. And remember one thing, patients understand that we're human, that we're not God, but they really appreciate honesty. So please treat your patients as partners. And I actually start off every consultation by telling patients, I'm not a mind reader. Ask me a question, I'll answer it. But if you don't ask me the question, I can't. And I'm not a fortune teller either. I'll do my best, I promise you that. I can control the process, I can't control the outcome. This again is extremely helpful as a professional. This is called the trust equation, which applies across all professions, especially for doctors. Trust stands for trustworthiness, C is your credibility, R is your reliability, I is intimacy divided by self-orientation. So what does this mean? Credibility means, can the patient trust what you're saying? Now remember, patients will trust you, but they will verify whether what you're saying makes sense or not. And the good news, or using Google, so they will always triangulate and check. Reliability meaning, when you're going to tell them, you're going to give them a phone call, you're going to share the results of the reports, do you actually do that on time or not? Intimacy means, are you in a rush, so rushed that you don't have time to talk to him? Or are you going to sit back and talk to him so that you treat him as a human being? And self-orientation is, does that mean that you're going to care about making money for yourself, or do you care more about him? And I think in order to become a good professional, the one thing which KEM will teach you is grit and discipline. And this is what Dr. Anjali said. If you can manage the workload which KEM throws at you in private practice or even afterwards, you're never going to have to manage difficulty. You need to work hard to earn your patient's trust, but it's worth the hard work. And this, of course, is a simplification. The easy way to be a good doctor is to learn how not to be a bad doctor. What's called the reversal or the inversion rule. And this is sometimes the problem, that doctors start getting arrogant and they think, hey, I'm God's gift to mankind and I know everything to do. B is your bedside manner. And this is something we keep on trying to teach you. Remember, the doctor can be the most powerful medicine for a patient. What's called your therapeutic presence. And the secret of the care of the patient lies in caring for the patient. And the patient can make out, are you more interested in treating the lab report and the CT scan? Are you more interested in treating him? I think this is a really important slide. And I wish I had more time and I could ask you more questions. But this is actually from the 19th century, when doctors didn't have antibiotics, you didn't have IV fluids, you didn't have CT scans, and you still needed to treat your patient. And this is a doctor who spent all night with a sick child, offering his therapeutic presence, his bedside manner, which was so reassuring, not just for the child, but even for the child's parents. But please notice one thing. There was no intensive care unit, there were no ECG monitors, there were no IV drips. It was just the calming presence of a senior doctor which made a difference. And please remember this, just like you are a person, a human being who has feelings, so are your patients. And it's compassion, kindness, and empathy which really bridge the gap between all the science which you will learn in KEM Hospital and your humanity. And people will never forget, patients will never forget how you made them feel. And of course, all you guys have a great IQ. If you didn't have a great IQ, you wouldn't get into KEM Hospital. That's taken for granted. What you really need to be working on is your EQ. This, I think we need to remember, is that if you love humanity, you will automatically become a good doctor. That just goes without saying. And this, I think, is the most important thing, because remember, your students, and the most important thing KEM prides itself on is being an educational institute. And you need to keep on learning how to learn and to unlearn and relearn. As a famous professor told us, 50% of what we're going to teach you now is going to be wrong. And the trouble is, we don't know what 50%. And if you don't trust me, do me a favor and get an edition of Harrison's Principles of Internal Medicine, which was written 50 years ago, and compare it with the edition today. And you'd be surprised at how much has changed and how many of the procedures which were standard in my time have become completely obsolete. So typically we learn from lectures, we learn from textbooks, we learn from our friends. Today I believe everyone goes to coaching classes and learns from them, but the best source of your wisdom is patience. And nurses are really, really extremely valuable sources of wisdom because they've seen so many patients over their lifetime. But you know what? The beauty about being a doctor is you never stop learning. And I'm learning all the time. And that really gives me joy. I think the great thing about being a young student today is you can play to your strength. You have a great education. You have a lot of energy. You have a lot of resilience because you've already been through lots of ups and downs to get into KEM. But the one thing which you have, which oldies like me who've become dinosaurs don't have, is the agility and the flexibility. And trust me, India's economy is booming. We're going to do so well. It's become the land of opportunity. Make the most of it is what my request is. So how do you learn? And I think the biggest problem is all we've been taught as students is to learn how to cram, because everyone only cares about exam marks. But really, curiosity is far more important than knowledge. And you've got to replace the fear of the unknown with the joy of being able to learn something new. Because the reality is you can never learn all of medicine. Whatever you learn has a short half-life, especially because things are evolving so rapidly. And I don't think there's anything to be scared about this. And it's perfectly okay to encourage your patients to ask you questions, even if they seem to be stupid questions to you. So how can we get doctors to innovate? And I think if you guys pay attention, you will notice this is not a picture of KEM Hospital. This is a picture of JJ Hospital. And the reason I put that up is sometimes the problem with being in KEM is you get this attitude is, hey, we are the best, we know everything. My request to you is please step out the four walls of this campus. Explore Tata Memorial, explore Wadia Children's, explore JJ Hospital. Each of these hospitals will do things differently, and there is always something to learn from these hospitals, so make the most of it. How do you reinvent medical education? And I think we need to teach you guys that all the knowledge is not locked up in lectures and medical textbooks. And we need to create an entire generation of digitally, technically savvy doctors who come up with innovative solutions, who come up with solutions which are right for India. And that's what our goal is. And we need to remember, it's not the guy who scored the highest in an exam who will do well in life. It's the person who can manage change. And trust me, everything will change every 10 years. And if anything, the rate of change is going to be even faster in the future. And I think this is an important slide. As a doctor, we're so focused on treating our patients one-on-one, which I think is great. Because when a patient is ill, what the patient needs is time, compassion, the fact that you're willing to speak to them and solve their problem at one time. Doctors shouldn't be cowboys and shouldn't be experimenting on their patients. But you know, the great thing about engineers is they don't just try to solve one problem at a time. They try to think of, okay, who are the other 99 other patients who have a similar problem, and what can we do in order to come up with a solution to solve them all at a time? And I went to Stanford. They have this great biodesign program, which actually is transdisciplinary. It helps engineers to think like doctors and doctors to think like engineers. But you know, one thing I'll tell you, fortunately there's no engineer here, but it's much easier for doctors to think like engineers because doctors are much smarter than engineers. And we work, yeah, maybe I'm biased, but the reality is any of you guys could easily have got into IIT if that's what you wanted to do. So I don't think really it's a problem of intelligence. It's just the willingness to learn new skills. And this is the reason we started Medical Innovation, Creativity and Entrepreneurship Laboratory. We started it in JJ Hospital. We've been running it for 6 years. It's extremely successful. We've been trying to start one in KEM Hospital because I think KEM Hospital students are brighter than JJ Hospital students. But I didn't say that publicly at least. But the point is every medical college needs an innovation lab because professors have seen so many clinical problems, but they don't know how they can use technology in order to solve the problems. And this is one of the reasons we've run this program. Just to give you another example, as Dr. Anjali said, we're both IVF specialists, but we see so many patients with polycystic ovarian disease or PCO, and we thought, what can we do in order to make the treatment of PCO kinder, safer, much easier, so that instead of doing a laparoscopy, we can actually treat these patients with vaginal ultrasound, which is a short procedure which any gynecologist can do for themselves. It cuts costs, cuts risks, cuts time, and in fact, we got a patent along with IIT. And this is what we really need to do, create partnerships with other institutions so they can learn from us and we can learn from them. I'm now coming to the end of my presentation. If these are the messages I want you to take across. If you want to be a successful medical student, please create your own website. And as Dr. Jatin said, I've been saying this for the last 25 years, and it's become even more important because your website will allow you to teach what you have learned. And it's important to teach other students. It's important to teach your patients. But you know what? It's really important to teach your professors because your professors they think they know it all. But often a lot of what they know is no longer true or accurate or reliable simply because things changes. And that's why you need to learn how to learn. I remember, as Dr. Anjali said, 40 years ago, when we went to Hopkins, we always felt as third-class citizens coming from a poor country because the laboratories were so much better, their MRI scans were so much better. But the beauty is thanks to KEM Hospital and the Municipal Corporation, we're now investing in making this a state-of-the-art hospital. Your libraries are brilliant, you have access, and for example, you can get access to any textbook, not even medical textbook, any engineering textbook, physics textbook, anything you want on Anna's archive. These are all full text. We've written a lot of books. Again, a lot of these books were written 20 years ago, because when we started practice, we said it's not so much about our doing well. How can we share what we've learned with junior doctors and other doctors? So all these books are available free on this website called The Best Medical Care, where we're really trying to help patients to take better care of themselves. And honestly, I think in this day and age, any doctor who can't use generative AI tools like ChatGPT or Perplexity is going to get left behind very, very quickly. And the beauty about ChatGPT is it's your personal tutor all the time. So there's never any reason to say, you know what, I'm a neurologist and I don't understand cardiology, or hey, I'm a diabetic specialist and I don't understand this. Patients are not interested in being treated as diseases or silos or specialties. Your job as a doctor is to treat the entire patient. And thanks to all these tools, you can use them. And whether you use them or not, trust me, your patients will and your juniors will. These are 3 simple things you can do. Please buy a laptop. And I've given a lot of lectures to medical students and to a lot of MBA students. But you go to an MBA class and they all have their laptops in front of them because they're taking notes digitally, they're recording the lecture. But when you give a lecture to medical colleges, they're still using pen and paper in order to take down notes. And I think I cannot believe why we would do that anymore. Because the moment you do it digitally, not only do you remember, you can share with the rest of the world. You can share with your friends. You can translate into local languages. You know, trust me, you guys are fortunate you're in KEM Hospital. But what about all the medical students who are graduating from Bihar medical colleges and UP medical colleges? They don't have access to your medical professors, and I think you have an ethical responsibility to help them to become better doctors too. As I said, create your website and become a self-directed lifelong learner. Don't expect to be taught, because the reality is no one can teach you. You're responsible for learning for yourself. The best thing to do is to educate your patients. And your patients are great unpaid research assistants. They will have so much at stake because it's ultimately their disease. They'll be happy to teach you. And I think the one thing you can recognize as a doctor is the joy of practicing medicine. Treat all your patients as VIPs. They are VIPs. They've trusted you with their life. Please respect that and take good care of them. And one thing I will say, when a patient thanks you, remember, they're not thanking your seat or because you happen to be a member of parliament or because you are an IS officer. They are thanking you as a person, as an individual, because they know that you helped them get better. And this is invaluable. Trust me, no one else in the world gets this personal connection. Please learn to make the most of it. There's lots of positive feedback which you get daily. It's such an opportunity. And I tell everyone, you know, it's not like a doctor's financial income is the best, but your emotional income is unmatchable, because you actually get heartfelt thanks from patients and their relatives every single day. And the best doctors are those who really enjoy what they do. And this is what I call the T-shaped model of life. Of course, you need to go deep, and I know a lot about IVF, but you also need to extend what you've learned into other fields. And that's why I enjoy being an angel investor, because medicine is just a small part of the real world. There's so much to learn about technology, financial technology, quick commerce, AI. And once you start putting money where your mouth is, you're forced to learn from these entrepreneurs, all of whom are very clever. And that's one of the reasons why we started this MA IVF Center of Excellence. We started the construction. I think hopefully it'll be functional in a few months. And not only will then be able to take good care of patients, we'll be able to teach students how to do this. Finally, I'm always grateful to KEM Hospital, because institutions make people, but remember, people make institutions. While you're in this institution, there is so much you can give back. And even when you graduate, you will continue to be able to give back. Please make the most of it. And that's my last slide. I think even if you forget everything else I told you, but you just remember this, that your responsibility as a doctor is to put patients first. You will be a happy doctor, and your patients will be happy as well. Thank you.